Deputy Denis Naughten.
Thank you, Cancórla. I've tabled this particular question to find out exactly, Minister, what your timeline is in your terms of reference for this national review of maternity services that's taking place, but also on reiterating the question that was asked by Deputy O'Quailon earlier, and that is, what now is the status of the tainted review that took place in the West North West Hospital Group?
Minister.
Well, as I've stated on the floor of the House on a number of occasions before, my department, in conjunction with the HSE, is currently preparing a new national maternity strategy, which will provide the strategic direction for the optimal development of safe and high-quality maternity services. The commitment to develop a maternity strategy arises from my acceptance of the recommendation of the HICWA report into the death of the late Savita Halappanavar. That report recommended that a strategy be developed to implement standard, consistent models for the delivery of a national maternity service that reflects best available evidence to ensure that all pregnant women have appropriate and informed choices and access to the right level of care and support. The strategy will incorporate a review and evaluation of our current maternity services. This will give us the opportunity to take stock of the services that are provided to women and their babies in our 19 maternity hospitals and identify how we can further improve the quality and safety of the care we provide. It is intended to finalise the new strategy by the end of this year. Thank you.
Deputy Naughten.
Thank you, Minister. The reason that I ask you the question, and you've now not answered it on 2 occasions here in the House this morning, is that the report that was done by the West North West Hospital Group specifically identified Portiuncula Hospital for the closure of its maternity services. In 5 of the 6 options involved the closure of the obstetrical-led maternity unit in Portiuncula. The other option was a do-nothing option, which was dismissed. Now, we're talking about the safest hospital in the hospital group, one of the most efficient hospitals in the hospital group, and the 2nd biggest hospital in that group. Now, the management team in the West North West issued a statement earlier this week, which they said that they are now going to subsume their efforts that have taken place in relation to the current review into the national review of maternity services. And I'm extremely concerned in relation to that, because it will not lead to the best possible patient outcome, will not lead to the provision of the safest possible services.
Minister.
Well, sadly, the Deputy is prejudging the situation. The National Maternity Review being carried out by my department is nowhere near finalised. I've made it very clear on the floor of this House before that the only status that particular report that was commissioned by the West North West Group was that it might be used to help inform the national review. But as of itself, it has no status. And my department will carry out the review specifically to ensure that we have safe and comprehensive services, and observing the underlying principle of our health policy, which is that patients are treated as near to home as possible in a safe, timely and effective manner. So I would ask the Deputy not to prejudge the outcome of the national review. It may suit purposes locally to upset people and undermine their confidence in their hospital, undermine the staff in terms of the security of their tenure. This is not necessary. There is no intention of closing Portiuncula Hospital or closing the maternity services there, and I'm putting that on the record of the House.
Thank you.
Minister, I'm not suggesting that, and I thank you for your clarification. The point that I'm making is, and I don't want to prejudge the outcome of this particular review that you have spearheaded. I think a review of maternity services is needed based on the death of Savita Halappanavar and what has happened in Portlaoise. We all want a quality maternity service, a safe maternity service. But, Minister, the difficulty is there is a report out there which specifically focused its attention on Portiuncula Hospital. And what I want is a reassurance from you here this morning that that particular report, which I believe is tainted in its content, never mind how it came about, but that that report will form absolutely no basis whatsoever and will have no input into the national review that takes place, because I believe there is an agenda within the West North West Hospital Group to undermine the services in Portiuncula, which is not in the best interests of women within the region and not in the best interests of women throughout this country.
I am very happy to assure the people of Ballinasloe and surrounding areas that they have in Portiuncula maternity services a very safe and a very good service, and one that I feel has absolutely a bright future. And we have no notion, without prejudging the outcome of this review, of having that service downgraded or removed, because I can't see where the patients would go.
Exactly.
And I would absolutely, however, have to point out that if I were to stand up here on the floor of this House and say that the West North West Group, having spent 20,000 on compiling a report, and that report was to be utterly ignored and not used in any way, I'd be castigated from a height for wasting public resources. So of course it will help inform it, but the fact that it talks about these options, and from memory I thought it was 4, not 5, which specifically mentioned Ballinasloe closing in terms of its maternity services, that, as I said on the floor of this House before, has no status in my view, and I see no rationale for doing that.